first heard about the Global Healthcare Initiative program when we had a guest speaker, and she came and lectured in one of my classes, and she was lecturing on health disparities, social determinants of health.
First time I heard about the program was actually just this past semester, and we had a guest lecturer in our gerontological nursing class, and she was talking about like the epidemiology of diseases and whatnot, and she brought up a global grant opportunity.
One other chance would I have for somebody else to pay for my trip to Africa. And I knew I wasn't working this summer, and I wanted to do something that was specific to nursing and nursing school, and it was just an opportunity I couldn't pass up.
One of our professors, Dr. Morton, is very involved with global experiences here. He is a pharmacy staff, and he's been in many of these projects in the past, so he constantly puts us on email blasts for these opportunities.
On the application process, you had the ability to choose 3 different locations you wanted to travel to.
Anywhere from Malawi, Rwanda, the Philippines, Japan, and a couple others.
And we're just basically seeing what life is like there and what the major problems are and what's being done about them. So it's all about observing and kind of just taking it in and not judging.
It definitely was a life-changing experience for me. It has changed the way I see nursing and the way I see problems and how to react to them. Most of the time we observed, and we went to visit different organizations and schools and health clinics.
We also met with non-governmental organizations, and really we just sat in on meetings. They presented to us and we had dialogue afterward. We also visited a reproductive health clinic, a hospital.
So we were basically just looking at their system, how they function and how they work.
There's a huge medical emergency, in particular need in Kenya. The example I like to give other people is if here you saw a car crash, you'd probably call 911. But in Kenya there is no 911 to call, there's no number, there's no ambulances at all, and when you go to the hospital there's no triage system. So someone with a cold could be before you in line, and maybe you have a broken back or something like that.
I'm a burn survivor. When I was 2.5 years old, I burned almost 30% of my body with 2nd and 3rd degree burns. To be able to spend those 2 days in that burn unit will forever change the way that I look at nursing. I always approach global nursing as something that didn't pertain to me. I went into nursing to be a bedside nurse. In global nursing, I had no intentions of practicing overseas, but by going overseas, this has reminded me that whether you go to a different country or a different state, everybody's your neighbor. Those borders don't exist when we're talking on a healthcare status.
It's interesting how they don't really have strict rules like we do here about pharmacy care, and I think that it's something they can definitely work on, because there people don't need prescriptions for everything, they just go to the pharmacy and get it, which is definitely, it can cause a lot of health and safety concerns, because they would try to diagnose and prescribe things for themselves and can lead to a lot of overdose.
They had a different way that I hadn't seen in the hospital here. In their ICU they had like a line on the bottom which nurses and patients had to remove their shoes if they passed through the intensive care unit. So that was really nice not to spread any bacteria.
So this project was also an interdisciplinary kind of project. So I was able to work with several medical students as well as my medical professor. So I feel more confident about being able to apply my interprofessional needs with them. And be able to see what kind of role they might play, what role I play, and how we can help each other.
Our schedule was pretty jam-packed with meetings, but we did have a lot of time for leisure and fun.
So on the weekend we went to 2 different resorts.
And then we went on a daytime safari at one of the wildlife preserves. One of the people in our group got to go snorkeling. We went kayaking. I raced sailboats, so I got to sail on Lake Malawi, which I had a lot of fun doing.
I think this experience has allowed me to see another culture. Here in the U.S., especially in healthcare, you're encountering lots of different people, lots of different cultures, so I think that this was another opportunity for me to move outside of my ethnocentricity and to really fully understand and appreciate that people are different, you know, based on the culture they come from. And as a future healthcare provider, I can use that experience to center my care on patients based on their culture.
I was born in Albania, and you think that you know how is to be poor and not to have anything, but when you go see these other countries, you're amazed how much they do for each other and the work that they do to get better.
You know, at times it may be hard, but it's important to keep that open mind throughout the trip, just to continue looking for the best in the situations and to really reflect on the feelings you're having and the experiences you're having.
It's an amazing experience. It's definitely something that you should apply for it. I felt like I got a lot of more experience I wouldn't even get going to clinical sites here. It's an easy application process, and you don't have anything to lose, and you have a whole lot more to gain.